Your concerns about an illness and travel to Asia.
And again, while the world is watching the outbreak of the coronavirus spread dramatically, some neighbors and friends of a woman in Catawba County are praying for her recovery. We want to go now live to Channel 9's Dave Faraday.
Now, Dave, it's important to say right off the top, there are no confirmed cases of coronavirus in the Carolinas before we start your report.
Yeah, that's right, Scott. But emergency personnel here in Catawba County, they didn't take any chances before going inside that home near Claremont. Neighbors tell us that they were wearing protective clothing after learning that the woman who was sick had also been in Southeast Asia. Senior pastor Nai Vang at True Life Church in Hickory says he became so concerned about a member of his congregation, he called Catawba County Sheriff deputies to this home near Claremont. But when they arrived, he says the deputy wouldn't go inside after learning the victim had recently returned from Southeast Asia and became so sick she stopped showing up at work. Vang says because she had also traveled through China on her way to Thailand, he too wouldn't go inside the home.
When we called the police, we told them that she came back from Southeast Asia. So they are very careful, and that's why the police did not go inside her house.
And you didn't go inside either?
I did not go inside either because I don't have mask, I don't have gloves.
Channel 9 has learned the woman was taken to Catawba Valley Medical Center. The hospital, along with Catawba County Public Health, would not tell Channel 9 if she is being treated for coronavirus. The health department says right now there are no confirmed cases in North Carolina, saying to protect individuals' privacy, the North Carolina Department of Health and Human Services will not publicly disclose the number of people being evaluated for the virus. Appropriate infection prevention measures will be taken if and when a person is under investigation. This man lives right next to the home in Claremont. He and his family are concerned that their neighbor could have contracted the virus. They're hoping for answers in the case.
She fainted while she was working, and so she came back to the house. And I guess she just kind of isolated herself from there.
Yeah, we've been told that she isolated herself for a period of about 3 or 4 days. We also found out that she never went to her church over in Hickory after returning from Southeast Asia. I just got an email from the health department. They're asking us again to emphasize there have been no confirmed cases at this point of the virus here in North Carolina. I've also been in close contact with the mayor over in Claremont. He is telling me that they're getting ready to send a press release in the next 30 minutes. We'll share that with you, Scott, coming up tonight at 6 o'clock. Back to you.
All right, Dave, we look forward to that. And certainly no confirmed cases, but a whole lot of concern really all across the globe. Thanks, Dave. Right now, Rowan County is monitoring several people there who just came back from a trip to China. Officials say that those people are not showing symptoms of coronavirus, but still they plan to monitor them for 14 days. And 4 people are being monitored in Mecklenburg County tonight. They'd also recently been to China, but were not showing any symptoms. Again, the Carolinas considered at an extremely low risk for the spread of coronavirus. But meanwhile, as the virus spreads globally, it's now getting a new name.
Yes, the World Health Organization is now calling this virus COVID-19. That stands for coronavirus and the 19 because it was first discovered in 2019. Regardless of what you call it, it is spreading at an alarming rate. In Hong Kong, 2 people who live 10 stories apart have tested positive for the virus. Now that is raising the question about whether this virus is airborne and can spread through pipes. They have since evacuated that apartment complex.